Hey, well, hello, and welcome to the Big Ten Early Learning Alliance's first ever panel discussion. Thank you for joining us today. We're very glad to see a great turnout for this first event. My name is Professor Laura Justice, and I'm a co-chair of the Alliance, and I serve as the executive director of the Crane Center for Early Childhood Research and Policy at Ohio State University. And I want to acknowledge my co-chair of the Alliance, Dr. Steve Barnett of the National Institute for Early Education Research at Rutgers, as well as Janelle Williamson and Michael Meckler here at OSU's Crane Center, who have been terrific partners with this and all other Alliance activities. Janelle will be monitoring our chat box and will be adding our housekeeping items there. So keep your eye on chat intel. First, I'd like to use this opportunity to share a little bit about the Big Ten Early Learning Alliance. This started from a series of conversations that Steve and I had starting in 2022. We're nearing the end of the pandemic, as you recall. And there was a federal initiative on the national discussion stage called Build Back Better, you may recall. And Steve and I started chatting about the strong focus on public investments in what was referred to as childcare. And we had conversations about how important it was as we see federal and state initiatives advancing early learning, early education agendas, that we be sure that research is infused in such policy initiatives. And as Steve and I chatted, the idea grew that why don't we try to involve a larger number of scholars in our discussions about building bridges between research and policy. And that led to our great brain spurt or something about bringing in scholars from across the Big Ten institutions. And so we officially launched in 2023. And we convened a steering committee from the 14 Big Ten universities at the time, who then invited affiliate members from these institutions, all of whom are terrific scholars in the world of early learning and early childhood. The Big Ten Alliance, it's a solid group. We function well. We just produced our first brief, which we'll be talking about today. And in the very near future, we'll be welcoming new members from our new Big Ten institutions. Our mission is to strengthen early childhood policies and practices through science. And I do want to acknowledge that our work has been made possible by a very generous gift from American Family Insurance to Ohio State University, and that provided the foundational support to get our alliance running. So let's get to today's panel. I'm going to hand things over to my partner in crime and co-chair, Steve Barnett from Rutgers, to provide some context for our discussion today. Steve?
Thanks, Laura, and thanks to everyone for joining us today. We're very excited to have this first webinar, the Big Ten Learning Alliance, becoming more real by the day. This actually stems from the brief that Laura mentioned, that she and I co-wrote, and which is on the Big Ten Early Learning Alliance website. Because as we did a first take at what do we know about the nearly 6 million young children in the initial 14 Big Ten states, now many millions more with the addition of California alone, it became clear that there were some limitations on what we could say about who is served, how they're served, and what the outcomes of that might be because of the data systems. And so this led to a conversation about, well, how might we improve data systems moving beyond just the kind of static who's in what program now, and to looking at kind of horizontal integration, which is across the various different programs that serve young children, and vertical integration that is looking over time at what are the experiences of young children and what can we say about their outcomes over time. So that's the genesis of the panel to just give you some sense in the state pre-K arena alone. There are 60 programs across 44 states and DC. While all of them can tell you how many kids are enrolled in their programs, surprising number can't even tell you who is served. What are the race and ethnicity and languages of the kids served? What are their family incomes? If you then begin to ask, well, what services do they receive? Do they receive services from pre-K, Head Start, childcare? What's the unduplicated count? Now we start having even more problems about uh, uh, data integration. If we want to know about, like, vast majority of these states collect data on quality, but are these data on the observed quality of programs integrated at the state level in a way that's useful? Most programs are required to have child assessments. Most states have kindergarten entry or kindergarten assessments. Again, are these in any way connected or connectable to the early childhood data, and not just in a kind of general way, but to specific kids where you could have longitudinal data systems? So you think about the number of agencies, health, labor, education, human services, and others involved. It's a complex issue. And that's why we're bringing you today this panel of people who are really, really good at doing this and knowledgeable about the challenges and hopefully some of the solutions. Back to you, Laura.
Great. Thanks. Thanks, Steve, for providing that broader context. And so, as the Big Ten Early Learning Alliance, and Steve and I sought to prepare this brief where essentially we wanted to describe early childhood across the Big Ten states. How many kids are there? How are they served? And it was really challenging. In retrospect, I can't help but ask if we should have just asked ChatGPT. How many kids 5 and under are there? Where are they served? How much money do we put into early childhood? But it was really challenging just even to start getting an authentic count of how many kids there are. Are they being served? Where are they being served? Are these programs of sufficient quality? What's the actual annual investment? And so the work of generating that brief led us to our goal of wanting to convene experts in various states who have their hands in these data systems to help us learn more. So that's where we are today. As we turn to our panel of experts, I'm going to ask each individual, and I'll call on you, and we'll go in order, just to present a little bit about your background so people understand the position you're speaking from. Benjamin,
Yeah,
could you
like
just,
an quick
yep, give us a
introduction. Yeah, yeah.
brief intro, please?
Yeah, no problem. My name is Ben Bohr. I am the Senior Director of Data at Education Systems Center, which is a center at Northern Illinois University here in Illinois. And I'm also the program lead for the state's longitudinal data system. And I'll say more about its connection to early childhood when I get an opportunity.
Great, thank you. Karen?
Hi, everyone. I'm Karen Garber, and I'm an early childhood policy specialist at NIEER at Rutgers University with Steve. And prior to my time at NIEER, I spent 16 years at the New Jersey Department of Education. And the last 7 or 8 of those years were in the service of trying to start up an early childhood integrated data system at the state. And like Ben, I'll save saying more about that until later in the panel.
Great. Rob?
Hi, yes, thanks for having me. My name is Rob O'Callahan, and I'm joining you as a guest from the state of Georgia. I work for the state agency here, the Georgia Department of Early Care and Learning, and I am the Director of Institutional Research and Data Quality. And I've been with this agency in our research unit for, well, before Nebraska or Rutgers were in the Big Ten. So it's been a while, and you know, I'm more on the data use side and how our data can be used for understanding our programs than I am on our IT side, which is a separate division.
Gosh, Rob, I heard you sort of snub Rutgers and the new joiners, and you're in Georgia. You're not even in a Big Ten, but you probably will be. I give it 5 years. So no, thank you for that. Yeah. And Kara from here in Ohio.
Thank you. Kara Wente. I'm with the Ohio Department of Children and Youth. I have to say, a graduate of the Ohio State University. I feel like it would just be wrong if I didn't add that in. I have the pleasure of leading Governor DeWine's KID agency that was newly created. So I've been in this role for just over a year. And I, prior to this, had 18 months at a local nonprofit here in Franklin County, Ohio. But prior to that, I had about 20 years in state government, fighting our program staff, and I was one of them, to get them to understand that data was powerful, not a weapon, and that we needed to bring it together to tell our story. So kind of been across the board.
That's great. Kara, I may be fantasizing this, but I have this memory of like 10 years ago sitting in a room with, I think it was you in, was it Franklin? Was it the state jobs and family services? And I kept saying, well, could we have data on that? And you're like, yeah. Can we have data on that? Yeah. And I realized you actually we have data on everything, but it's just really hard to use it.
That is true. We did have that conversation. And we do have a lot of data that I know we will talk through, but we do have the word solution that was used earlier. I will not jump to, but we do have a common key that we can now leverage. And in the new department, we're actually seeing the benefits of that today. So we're getting closer. We're definitely getting closer.
That's great. Benjamin, Karen, Rob, Kara, you represent Illinois, New Jersey, Georgia, Ohio, and I see you all as people who really have your hands in the machinery of the data, the questions. We're all interested. And one of the goals, I can speak for Steve and myself, is in creating the Big Ten alliances. Can't we learn from each other? Even Georgia, you know, we're all right here. We're all doing and caring about the same things. So what can we learn from each other? And so that's really what today is about. Let's learn from each other. I'm going to start with a question to Karen. So you currently work as a policy analyst at NIEER at Rutgers. But before that, for 16 years, you worked in the New Jersey Department of Education, and part of that work was building early childhood data systems, specific to New Jersey, I believe. In your experience, could you highlight for us what are, say, the 3 biggest barriers that exist in establishing accessible early childhood data systems?
Sure. And I think in starting that work and just listening to what Steve was saying and what you were saying and what Kara was saying, I think we engaged in this work because we realized that we were drowning in data, but still starving for information. Like we had all of this data, but we couldn't put it together. And so what were the things that we needed? And as I was reflecting back on that work and thinking about, what those biggest barriers were, they fell into a couple of buckets. I think funding was the biggest challenge we faced. Building these systems can be really expensive, and not just building them, but maintaining them over time. So it's not that you just need one shot of funding to establish these systems. You need initial funding and you need ongoing funding, and finding that can be really challenging. New Jersey, like a lot of states, we took advantage of some federal grant opportunities to get the work going. We had a Race to the Top Early Learning Challenge grant. We used some preschool development grant funding, and also some state longitudinal data systems funding over time to jumpstart our ECIDS system. But then we found ourselves in trouble when those funding streams were gone and there wasn't another one to connect to. And we also found it really challenging because in a few cases, we would apply for a grant when one governor and one administrator was in office, and then that person would leave office during the course of the grant. So when the grant ended and we needed another funding stream, we were speaking to another governor's office, another administration who hadn't been part of the original conversation in starting this work in the first place. So that funding piece was one of our biggest challenges. Expertise was another one of our big challenges, and that was on a couple of different fronts. I was a program person tasked with trying to figure out how to build one of these systems, and I didn't know anything about the IT side of things. And I reached out to the folks in the IT department at my department, and they couldn't translate what they needed into language that I could understand and vice versa. And so we kept having these circular conversations about how to build the system. We couldn't quite get ourselves out of this loop of a conversation where we were using terms that we each thought we understood, but we were actually using them in different ways. And I'll actually give an example. The folks in our IT office kept asking me what the requirements of the system were. And I kept telling them the requirement was to build an ECIDS. That was the requirement. And they would kind of look at each other and look at me and say, no, we need to know what the requirements are. And I kept saying the requirement is that we build a system. I realized after getting a little bit more knowledge that when they use the word requirements, they were talking about something very different, something much more detailed, something much more technical. And it wasn't until we gained some of that expertise, and I'll talk about that in a minute, that we were able to overcome that challenge. And then I think in a lot of states, the state agency doesn't always have the expertise in how to analyze data and then interpret and report on that data. And so that was another challenge that I saw within our department and in other states across the nation, that they build these systems and then find themselves in a position of not having the capacity in-house to be able to actually interpret and report out on the data that's coming out of those systems. So that expertise was really a big challenge. And then I think the third challenge was, I'll put in the broad category of trust. And that was a really big one for us. And I think it's, I don't think unique to the journey that we had in New Jersey. It comes from a couple of different places. I think one, the folks who oversee the programs and services that are collecting the data were very reluctant to share their data, even with me, one of their colleagues. And it's because they feel very nervous that their data is going to be misinterpreted and therefore misused. And in many cases, then brought back at them in a critical way about how they're administering their programs. So there were a lot of issues around trust. I think also along those lines in trust, in order to build these systems, I think in almost every case you need data sharing agreements. And the lawyers who we would work with on those data sharing agreements just inherently were conservative about how data is used, where it's used, why it's being used. So building trust across the systems within and across our state agencies was another one of the big barriers that we faced. So I think funding, expertise, and trust, those are sort of the big three challenges that we were trying to overcome.
That's fascinating. So we want, whether we're practitioner, policymaker, researcher, we want usable early childhood data systems. And Karen mentioned these barriers comprise funding, having expertise to use them, and trust. I am curious if Benjamin, Rob, or Kara want to chime in and either counter what Karen shared from New Jersey or build upon it.
Well, I mean, I definitely echo everything that Karen has said. I mean, yeah, I mean, and when we talk about, what we've done here in Illinois, I'll talk a little bit about the expertise we were able to bring to the system. Funding is always a concern, and I can talk about, what the situation here was funding. But I did want to, I mean, I I love where Karen ended, which is the trust point, right? Like none of the rest of it works without that trust component. But I think what's worth noting is there are ways to build trust, right? Like building trust can be in a very intentional process. There are ways to set up your data system so that it gives people control. And if they have control, they trust the system more. There are data agreements, there are processes you can put in place. So we think of trust often as sort of this ethereal concept, but it's not an ethereal concept. It is actually a process. It's a concept that can be operationalized. And I think that's a really important piece to the puzzle.
Dr. Justice, if I can add, can't echo enough the importance of trust, but I will also, you can't see the sign behind me, but it says, don't let perfection be the enemy of the good. And I think when we start to build our data systems, because our work is so nuanced and because we don't have that trust or we're afraid it's going to be used inappropriately, we sometimes get stymied in but we need to add all of these safeguards. And really, you need a process to make sure that before your data goes out, the right people get a look at it to make sure that it's accurate and it's portrayed the way it needs to be. We don't need to build in every safeguard. And I will say from experience in Ohio, several administrations ago, we started to just try to answer 5 questions in the early care and education space. The number of kids, what services they were receiving. It was 5 very distinct questions. And the price tag very quickly was multiple millions of dollars. And everyone said, for 5 questions, we can't do this. So we ended up getting stuck because we kept trying to build in every scenario. So I say that to say we all have to be aware of how to safeguard, not just to build trust, but to build in the process if we're not sitting in the seat, that someone has the ability to review the data, but to not let that be the reason we don't move forward. It took us a long time to get there. I'm proud to say we have overcome a lot of that. But the trust and the not over engineering is just key to moving the needle forward.
Eric, can I have all your data?
You can, but I think we give you guys a lot, but we can work on it.
Sorry, I think I just snorted on a webinar. I did. Let me ask a question, and Janelle's like, you're going script, but I am going to get back to talking with each of you. But if, you mentioned these barriers. If I, let's say Steve Barnett, well, this isn't a made up exercise. Let's say Steve and I wanted to build on the brief the Alliance just created and ask your states, the 4 states represented here, for help answering the question of, I'm coming up with a simple question. Can we link state and local fiscal investments of various types in the child care system to child outcomes? How far are we away from that? Being able to answer something that important, but kind of complicated. Rob, Karen, Benjamin, Kara, is it a pipe dream?
So I'll be brave and go first, and then they can add. So as probably someone that's in the newest developed entity on the screen, we are a state agency, obviously operating early care and education. And as we are preparing for our next biennial budget, we, of course, are talking about the investments that have already been made. We've been very fortunate that the Governor and General Assembly have allowed us to invest and expand access and to 200%. But what we're saying with that is we really want to track that our outcomes in kindergarten readiness and access to services are following along as we expand that eligibility criteria. If we're serving more kids, we should see more kids end up kindergarten ready. And we have a kindergarten readiness assessment. So every kid takes that assessment, when they enter kindergarten prior to November 1st. So we can look and track that data. We are now trying to tie that to say, what are our benchmarks? If we continue to expand, how many kids do we think we're going to serve? How many of those kids do we think will actually move in readiness? Because it's certainly not every kid. and where do we think we're going to land? So as we're talking about our preparation for our biennial budget, we're actually putting out a goal, and it's big, it's bold. People think we're crazy, but there's data behind it that we hope to move our kindergarten readiness demonstrating score from 36.5% to 60% of kids. Now, we have several years to do that, but if we don't start tracking to it, then we need to figure out why. Is it just that the kids have more barriers, and how do we address those barriers? How do we stabilize the family? But those are the questions that data should allow us to ask to then drive to move the needle. And so I think we're closer than you think.
Yeah, I would agree. In Georgia, it's not an impossible dream. It's not something we could deliver tomorrow either, but it's definitely a goal of ours to track our funding and combine our different funding sources, and to say something about each locality in Georgia, how much funding across all funding streams is going there for early childhood.
Yeah, Laura, I'm going to agree. I don't think it's a pipe dream. I think we have to be careful about what question we're asking. So I think, as much as each individual service should be assessed and there should be conversations about each individual service, I actually think what we're trying to accomplish here in Illinois is to better understand what's the continuum of services. Because, we have these programs, kids start, visiting from the very beginning, then they go into childcare, then maybe they go into preschool, they maybe go into Head Start. I don't think we see the issue that any one of those programs has, there's definitely things that could be fixed with any program, but it's not that those programs have a lot of problems. The issue is the continuity between the programs and how those programs meld together in a way that delivers services well. And I should say, right, that's part of the thing that's happening here in Illinois is we are actually establishing a new Department of Early Childhood. And that's the sort of reason behind it, right, is to create that continuum of services. And then the question is that continuum of services producing value on the other end, right? And I think that's an important question, but it's sort of secondary to, hey, are we even getting kids the services they need?
It's really helpful. Love people introducing themselves as we go along, and do one of the things I'd like to hear people from. I mean, everybody tuned into this for a reason. When you, from the position you're in, think about state data systems in early childhood, what is it you want these to be used for? I'd be really curious of different perspectives on that. Let me jump to Ben. So Ben, you're the project director of the Illinois Longitudinal Data System, which, as I understand it, and I might be getting this wrong, it's a system for data integration across Illinois state agencies that support children and youth. Walk us through, now don't be super wonky, but walk us through what it takes to build and maintain a data system like you're responsible for. What does this involve?
So I have this Python code that I wanted to show all of you.
That's
okay. No.
Okay, I'm told you can be as wonky as you want. So go.
Okay. No, of course. So first of all, I think it's helpful to talk about why I'm here, the longitudinal data system person, as opposed to an early childhood person or somebody else, right? So in Illinois, our longitudinal data system is actually a governance agreement across 8 state agencies. And those agencies include our 4 education agencies, our higher ed agencies, and our state board of education. It also includes DHS, but we work most closely with the Division of Early Childhood and the Department of Child and Family Services. And then the other end, we actually work with our Department of Commerce and Economic Opportunity and our Department of Employment Security. You might think, what does the Department of Employment Security have to do do with early childhood, but in fact, knowing, for example, how the workforce works in early childhood and connecting that, and they have our wage information and all of that. So really, when we think about early childhood data systems, it's not just the data about children, but it's the data across the spectrum, the higher education system. How are we educating early childhood educators? All of that, that's important as well. And so that's actually the first thing I'll start with, right? Is like, I think to do this work well, you should be doing it in the context of your longitudinal data system. Now, I'm biased, obviously, about that, but I think, having separate, and you can have separate governance. You can be creating research agendas in early childhood versus the K-12 and higher ed world, right? Like you can have different elements this, but there's a need for the data to be integrated across all of those systems, and I think there's real value there. So that's a really important piece. I think the other thing, and this goes, what I'm describing is to have a governance agreement. And I think that's really important as well, and have a strong governance. And in fact, I think in Illinois, I'm not going too far on a limb to say, I think our governance needs to be strengthened over time, because a lot of this, as we talked about already, is around policies and processes and making sure that there's trust, and that trust is built by people being in conversation with each other, and that's really what governance is about. The other thing I want to mention about the Illinois system is that we're really here just to staff it. So we staff the governance, we help design some of the process and policies. The actual data system is housed at the state. And so there's a centralized system at the state. We have a really strong partnership with our Department of Innovation and Technology. Karen mentioned expertise, right? There's only so much that expertise that one or even a group of people can have. There's just a variety of different roles that these systems require. They require staffing of governance. They require legal agreements. They require data analysts. They require, I will get wonky for a second, right? They require data engineers who actually know how to clean the data and make sure it's in the system. They require UI experts that can build data tools. There's data analysts and researchers who can do real research on the system. All of those are disparate things, and that's a lot to capture there. I will say, and I want to just call us out, we're very blessed here in Illinois. We have a great partnership with the University of Illinois, the Illinois Early Childhood Asset Map group and team. I know Dawn's on today. She's actually the one that recommended me for the panel. They are just a fantastic team to work with. They know the data. And again, back to expertise, like having those experts you can rely on who really know the data in combination with the process and stuff, I think is really important. So we're just a facilitator, right? But we're trying to, we match make, and we do all of those things. We do all of those things together. And then I do want to come back. I want to come back to Karen's point about trust, because I think it really is the most important piece of this. We have we have a particular part of our project that we're doing right now, which is around collecting Head Start data. And we're working very closely with Illinois Head Start Association on that work. And it's really been a partnership, and we meet with them regularly. We have conversations about how we're going to collect the data. They're actually the ones that have gone out to all of the different grantees and talked to the grantees about signing data sharing agreements with our Department of Human Services. We now have almost all of I think 50 of our 55 grantees have signed data sharing agreements with our Department of Human Services. And as you can imagine, that requires a lot of trust on their part to be willing to give us their data and allow us to integrate it. Now, we have defined data sharing agreements. We're only allowed to use that data for particular things. But if we were going to use it to, do evaluations and hold people accountable in ways that are inappropriate, that would go against all of the trust building we've done to date. So it's really about bringing that together. And I will say, right, like, back to this conversation about the continuum, if we don't have Head Start data, I mean, honestly, I just don't know what a system looks like. It's 1/3 of all the dollars that we spend on early childhood. Like, what does it mean to have a data set that doesn't have Head Start data in it? So this is an incredibly important piece to the overall picture. So, we've built that trust through governance, we've built that trust. And then the last piece is we've built that trust through the way we've designed our system. So our system is a centralized data management system. We don't actually have a centralized data warehouse. We actually expect all the agencies to make their data available for sharing. We're doing data documentation all in the same way across all the different agencies, and then that data is brought together. And then every data project needs its own data agreement. So be it a researcher coming in, ICAM, they're actually the ones building what we call our early childhood participation data set. Going back to what Steve was saying, the first question we're trying to answer is this participation question, and we've been very focused on that. But producing this early childhood participation data set, so ICAM is actually the team not only develop, everyone knows them because of their front-end tools here in Illinois, but they're actually developing the underlying data set itself that will be used for research and other things. And they've had support from Chapin Hall on that as well. But they're building that data set. But now they want to build their interactive tools against that data set. We actually have to have another data agreement to allow them to use the data set that they've built to build their tools. I know that seems convoluted, but that's how the system should work. We should know exactly why people are using data and for what purposes. And so even a team that's actually building a data set, if they want to use it for another purpose, we've got to have a different data agreement in place. Now, we've got to streamline all those processes so that they move very, very quickly. We're still working on that in Illinois, but those are some of the different elements that we're trying to hit on to address some of the barriers that I think Karen raised.
Yeah, that's great. That's really helpful. Two quick points. I do want to call out Dawn Thomas. You specifically reference her team, University of Illinois, Champaign-Urbana, and one of our steering committee members at the Big Ten Early Alliance. She's terrific. And that's a really great example of a university-state agency partnership. I also really valued the approach you use where it's a very decentralized system. And I like that idea of having, building the capacity in different agencies to collect their own data and use data labels and cleaning procedures so everything conforms. It just seems like you're building a broader capacity than housing everything. And as we move on in this panel, I'd be curious if we see that same model elsewhere, because certainly there's other models where everything is centralized.
Well, the last thing I just wanted to mention, Karen brought up funding, and I just want to articulate how difficult the funding conversation is. One of the reasons why early childhood has been the major focus of the LDS over the last few years is that we have been using PDG funds for the development of our system. And as those dollars have ramped down, we've been looking for other funding sources. I will note that OMB put forward guidance in April that allows federal and state agencies to use more of their grant dollars for childcare, for Medicaid, for a variety of other grants for purposes, for data purposes. And so we're looking into that. We're looking at what it means for us, but it's a pretty important sort of guidance by OMB, federal OMB, that there are pools of funding for this that should be that I think we can tap into over time.
Great. Before I turn to Kara and Rob, because I have some things I want to gather from you, can each panelist, I'm going to invite each of you to give a very, very short response to a question I have, which is each of these states, Georgia, New Jersey, Ohio, Illinois, you each have a state system of data. And you each mentioned that funding is an issue. From your perspective, what is the number one reason why you have a state system? What's it for? The number one reason you have the system. What's it for? What would you say from your perspective?
I would always say that we were building our system so that we could talk about the collective impact of our programs and services on children over time.
So from Karen in New Jersey, you would say it's to understand impacts.
Yeah.
Okay, what about the others?
So I'll jump in. I will say I think the initial intent of the system was to create accountability. I think what we're shifting to now is to show return on investment and where more investment should be made. So I
Okay.
think we're starting to see that culture shift.
So, and again, those are so New Jersey show impact. Kara, your perspective is great. I mean, this is not a political statement, but we have for a while and I've been a fairly conservative state, and seeing accountability within broader conversations is par for the course. So accountability, and then now really about ROI, not totally unrelated. That's really helpful. Benjamin, Rob, what would you say?
Yeah, I mean, I would definitely echo. I think on paper, probably impact is what we would say, but in practice, a lot of it is also like community partners and their needs assessments, grant applications, things like that, and including our Head Start. I mean, that's, we got the buy-in from Head Start agencies, and I think that's really important to them for their reporting needs.
That's really, really interesting.
I'm going to cheat and go back to our mission.
No, you can't. I want to know, when you're showing up to work every day, who's breathing down your neck?
Well, I mean, the mission statement is to drive policy and practice. And I think the challenge of that is that there are just so many ways to do that. So, we're building our system so that researchers can come into the system, can develop research reports, so that can drive policy decisions. We're building it so agency staff can come into the system, so that they can do analytics, so that they can drive policy. And then at the end of the day, and this is why the partnership with ICAM is so important to us, we're building data tools so that communities and others have data tools so that they can make decisions. People use ICAM to help write their grants. They use ICAM to help make decisions at a local level about what services need to be provided. So I know that's a broad spectrum, but it's hard for me to prioritize any one of those things over the others. And in fact, I think a system that's designed to do all of those, actually meets a variety of needs and is more efficient at the end of the day.
So that's really helpful. It's actually really, really helpful. And, we won't go into this now for lack of time, but, I'd be curious to know how much from your positions, okay, this is about accountability, this is about ROI, this is about student outcomes, how close are we between having the system and it achieving those ends? But that's for another day. Kara, I'm going to jump to you. So, I don't know if you briefly want to mention, there's been some pretty dramatic changes in the last couple years around the structure of the state in terms of systems that support children. If you want to comment on that, Kara, and your position in that, and maybe highlight the fact that you're actually a cabinet member. But I think you think we're getting better in Ohio with respect to our system. So do you want to talk to us about what you've been up to?
Sure. So yes, the governor in the last budget created a new cabinet level agency to focus on kids, much like we're seeing in several other states. We are fortunate, though, that we were created on July 4th of 2023. And sitting here today, I'm sitting in our new department, and the more than 500 team members are here, and they have been since January. We moved very quickly to identify our team members, get them into the office from 5 state agencies. So we have staff from developmental disabilities, the Department of Developmental Disabilities, the Department of Mental Health and Addiction Services, the Department of Education, the Department of Job and Family Services, and the Department of Health. And with that came child serving programs from prenatal to the age of 21, because we have early intervention, home visiting, maternal and infant vitality, all the early care and education, including preschool special education and children's services. So when I think Ben was talking about the continuum of care and how we're really looking at data to see what the investment is showing, that's our goal, right? We're not looking at it in program silos, and we've actually broken down those silos. So we don't have like a pillar of childcare anymore. We don't have a pillar of early intervention. We have some staff that are subject matter experts, but they are on a team that is focused on policy or training. And we're only a year in, so we're learning a lot of lessons, but it's creating accountability across the board. We now have early care and education professionals who have been in the field for 20 years saying, why wasn't I talking to my families about home visiting? Why wasn't I talking to my early care and education professionals about referring to early intervention? These are things that we naturally think should happen. We believe we did a good job of sharing that information, but it wasn't getting down to our frontline team members, predominantly because there's just a lot of turnover and they are focused on serving that kid and that family in the moment. So how do we make it easier? Bringing all these programs into one department not only has allowed data sharing to be easier, but it's allowed those conversations to be easier because they all report to the same supervisors, right? You're naturally going to have better conversations when accountability is at hand. That said, when you specifically asked around our systems, first and foremost, we are fortunate. We had the Race to the Top Early Learning Challenge grant. We created what we call the statewide student identifier because obviously our Department of Education, now Department of Education and Workforce, couldn't share a social security number. Well, our longitudinal data system is at the Department of Education and Workforce now. So our child serving programs have the SSID. All the ones I mentioned, plus SNAP and TANF, have an SSID. So we have a common key now. That's relatively new. In the last 2 years, that's happened. We now funnel that information into our Innovate Ohio platform. Where we're at, though, is it's not super user-friendly. So we're still building out the analytics of that. What I can tell you from the new department standpoint and having all of these programs under one roof, in January, my public preschool program had slots open. And I also have children's services. So I knew how many 3 and 4-year-olds I had in children's service custody, and I knew they were eligible. So I was able to cross-match where those kids were with where I had slots and make connections. And within 2 weeks, 150 kids had access to programming. Previously,
can I ask a question?
Sure.
I'm sorry. How does that happen? So seriously, so you have data that says we have openings.
Yep.
You have another data system that says I have kids in custody. Like, how does that actually happen?
Yeah. So we know where the kids are in custody and placement, and we knew the providers that had openings because we had the enrollment data. So we could take those children and we notified our local, we're county administered. So we notified our local agencies that had custody and said, hey, you have families that have custody of these kids that they didn't expect, right? Predominantly kinship placements, foster families, and they're automatically eligible for our public preschool program. And here are all the programs in your county that have openings. And then we notified our public preschool providers that, hey, these families are going to come. Here's the note we sent them because you should know that they're eligible because they're in custody. They're automatically eligible. So we could make those connections. And I will just say it happened in a matter of a couple weeks where we pulled the data and made the communications, where previously to do the data sharing agreement, we all work pretty well together, but it would take us 8 weeks to have 2 state agencies run up a memorandum of understanding, get all of the very well deserving and serving individuals all on the same page to then match the data to then take the next steps. They're under one roof. It just made it simpler. We have another example that I would just highlight where early intervention, once that kid turns 3, the funding stopped. Well, in Ohio, we have about 2,000 kids every year that age out of early intervention. They don't qualify for preschool special education because of the differences in the focus of those 2 programs. And if they locally don't have any additional programming, that child goes unserved at times until they go to kindergarten. After we've just invested time and the families on board. So we created a pilot with our public preschool program in 4 counties where we actually targeted those families that they fell in the gap. And we said, you know what, we can't give you what you were getting with early intervention, but we can give you 2.5 hours a day in a quality educational setting to maintain that child in a consistent environment with another adult. And we just expanded that program. That could happen because we had access to both data sets and we could make the connections. Now, it took a lot of hand-holding, right? Because once they aged out of early intervention can't have the data anymore. So then you have to, so it took us kind of playing in the middle, and we're looking for ways to streamline that. So it's by no means perfect, but we are seeing families benefit from us being able to run in the middle of the data sets.
I
Laura,
think,
Laura, could I just jump in for 1 sec? Because
yeah,
I just wanted to make 2 points about what Kara has said there. So one, I mean, what Kara's describing is just awesome, but I do think it's worth making a differentiation between sort of what I'll call an operational use case, how you use data to actually support programming, and analytic use cases, like how do you do research and stuff. We actually need different types of data systems for those different use cases. And the only reason part of the reason I mentioned that, and I saw Elliot Regenstein make a comment in the brief, is Elliot and the Data Quality Campaign just released a new brief on different early childhood use cases. And I think it's just worth calling out because that brief actually gets at this sort of difference between when are we using data for analytics, when are we using them for operations, and how does that all mix together. So I just wanted to highlight that, for other people to be able to look at.
yeah, that's actually where I was going to go as well. Two things, Kara. Number one, I think I cannot tell you how many times, I wish I had $1 million. Now, I'll take $1 for every conversation I've been in for 17 years in Ohio where people said, can we just have a unique identifier? What will it take? And so, and I do think under your leadership, I mean, you were really bent on making that happen. So kudos to you and your team. The other thing I want to say is, notwithstanding Benjamin's points here, what you've done is something that, I mean, it does get at the use issue, but you're using what are meant as really large scale data systems almost in a case management way. And what's really interesting about that, I haven't at the state level, the conversations might not take place like this, but sometimes when you're involved in initiatives, say at the neighborhood level or the county level, and people are building new data systems, that is the perennial tension. People see data systems as case management, doing exactly what you were just describing. Or it's more of a somewhat distal infrastructure that doesn't provide real-time information. So I think there's something really interesting that Kara was sharing about that. It may be impossible for other places to do that, and perhaps, Kara, impossible to sustain. Curious.
I'm going to remain optimistic. I think we're just getting started.
Yes.
And I say that because as we start to show the value of this data, it allows us to ask for different grant opportunities. It allows us to tell the story on why this work is so important. So to the point around, it's hard to get funding for the data systems. We have to be able to talk about them both ways. And you guys have highlighted that much better than I could, but being able to show how we use the data because of the statewide student identifier, because we were able to bring these programs under one roof and quickly move to show where there's a gap and to meet the need, certainly allows us to have additional conversations around the ultimate goal of, we had a young child that we lost here, tragic as it is. We have children's services. I'm responsible for children's services in the state of Ohio. And one of the first things we had our team do, they had to go into multiple systems. How many times did we touch this child? Where did we lose contact? And why didn't we know that they stopped engaging with home visiting 6 weeks prior to losing them? Because we could have engaged differently. And that starts to get to the bigger picture goal of, how do you start doing some predictive analytics, which makes people super uneasy if you haven't shown that you're using it for the right reasons. So I think we're just really on the beginning edge here in Ohio. I haven't even got to talk about our early care and education workforce data, which is super exciting. But I do think there's it's not about case management or long-term longitudinal data systems. It's showing why the need is both.
Yeah, that's great. Rob, I'm going to put you in the hot seat. So when we discussed over the last 4 to 6 months data systems, and we were really talking about the Big Ten states, Georgia came up quite a few times actually as doing something really, really well. And so in the last couple minutes we have together, it would be great if you could round out this discussion and share with us how is the early childhood data system structured in Georgia? And do you have examples of how this has brought benefits to children and families in your state?
Yes, sure. I've heard this a lot, that we have great data. You know, I live in it every day, and I'm always seeing the limitations of it. And I think our system does run the gamut from really clean, accessible to it takes 4 to 6 months to get a report and you still can't read it. I get that the limits there that other state agencies face as well. One thing I think we have done well is, like Kara said, we also are a consolidated state agency. I'm actually at an event today where we're celebrating 20 years as a state agency, bringing all of early childhood under one roof. I mean, I think the benefits of that are huge. I can't imagine how we would interface or connect our data without that. It would be a lot more difficult. The most recent, it wasn't until 10 or so years ago that the subsidy program came into our agency. And so when that happened, it was just like, okay, it's go time. What does the data look like? And we just jumped in. How do we get it to, it's still an external vendor, but how do you get it to interface with our data? And I think we have a really robust IT team, and I think it's been important with them, whether we build some of our systems, our licensing system, our QRIS, we built them ourselves. Some of them we've worked with vendors, and some of those have been very responsive, and the data is very transparent. And I think having that kind of relationship where we're going to get the data exports we need, we're going to send the data to you that we need, our systems are going to interface so that our programs talk to each other. That was like a very high priority for us. And we also, like Karen mentioned, state capacity to interpret their own data. We do, it's kind of the reason that we have our own research unit as well, is to be that state capacity for the agency. We have to be the subject matter experts on our data and speak enough IT, know the programs, and be able to be a go-between between those. Yeah, I think that's been key for us as well. Where we want to be is to be in a place where we can interpret our data well, and we can tell our own story, and we're not relying on people who don't know our systems to interpret it for us. Some areas where I think that's really been, especially in the policy world, is where we're trying to inform our own policy leadership, and that's where we've really seen benefits. With the pandemic relief funding that we got from the feds, it was having strong data systems that we understood and knew how they worked, that we could be really nimble and very quickly adjust, put some fixes in, or make some quick changes so that we could get money out the door like within weeks of receiving it, and not be waiting to build those systems. I think also, Georgia has some of like the, going back to just like basic licensing data. We have consultants who put eyes on thousands of childcare programs every year, and so having having really quality data collection there has been really important, and that we use that data to try to improve policy all the time. One thing, we have some of the worst ratios in the nation, and we want to look at what are the real world ratios that are out there in the field, and how can we, is there a critical mass where enough people are operating at better than required ratios that we have the leeway to go ahead and improve our ratios without too much pushback. And for whatever reason with the pandemic, we saw that we've seen lower classroom sizes, and so has not quite gotten back to where it was pre-pandemic yet. So there is an opportunity there. Yeah, I could go on, but I know time is getting short. I'm also open to collaboration and being contacted by anyone.
That's great. I was hanging on every word you said, Rob, and it occurs to me that I think we could do a full hour with each one of you, Karen, Benjamin, Kara, and Rob, about really to build on what you've shared with us about your very unique data systems, so that we can learn from each other. Fascinating. I don't think I'm the only person to say that I'm sad it's 1 o'clock. I want to thank our panelists for joining us. You have been an absolute treasure trove of information based on your respective leadership positions. We hope we can welcome you back. I want to thank Steve Barnett for being my co-chair of this alliance, and I hope that you will all come and join us for our future events. Have a great rest of your day.
Thanks, everybody.
Thank you.